prosperity, the well-being of the Egyptian people. So without further ado, I would like to give the floor to Dr. Al Dardari, who is going to talk to us about the progress that has been done in the past decade in human development. Thank you.
You will speak from there.
السلام عليكم. سأتحدث باللغة العربية لو سمحت. احنا بالشام بنقول صباحكم عربي بالصلاة على النبي. بصراحة أنا سعيد جدا باعتباري مسؤولا عن المنطقة العربية في برنامج الأمم المتحدة الإنمائي أن نجتمع اليوم في القاهرة ونتحدث عن التنمية البشرية. التنمية البشرية مفهوم قوي للغاية، مفهوم يتجاوز موضوع النمو الاقتصادي ويتجاوز موضوع فقر الدخل، ليشمل كيف يمكن أن نمكن الإنسان من أن يستفيد من قدراته وأن يحقق طموحاته وأن يتمكن من التعبير عن نفسه وعن إمكانياته. التنمية البشرية بالمفهوم العلمي الحديث ظهرت في تقريبا نهاية الثمانينيات في بداية التسعينيات على يد شغال اوكي على يد شخصين حاصلين على نوبل في الاقتصاد، أمارتيا سن ومحبوب الحق، وقد وضعا تصورا بأن التنمية البشرية هي كمفهوم وكتطبيق يجب أن تعبر عن مجموعة من المعطيات المتعلقة بحياة الإنسان، وخصوصا الصحة والتعليم، وأيضا حصة الإنسان من الدخل ومن الاقتصاد. بناء عليه تم تركيب المؤشر إذا كان تم تركيب المؤشر من ثلاثة مكونات، ما يسمى مؤشر التنمية البشرية Human Development Index. هو عبارة عن مؤشر مركب متشكل من ثلاثة مكونات. مكون الصحة ويعبر عنه بالعمر المتوقع عند الولادة، يعني ما هي سنوات العمر المتوقعة عند الولادة، كمؤشر يعبر عن الواقع الصحي للإنسان وللمجتمع، ومؤشر حول التعليم وهو أساساً ما هي السنوات المتوقعة للتعليم لكل فرد. هل سيستطيع الإنسان أن يتعلم 6 سنوات، 9 سنوات، 12 سنة، أو يحصل على التعليم الجامعي بعد ذلك؟ والمؤشر الثالث هي حصة الفرد من الناتج القومي Gross Domestic Product، Gross National Product، وهذا يعبر عن الاقتصاد. إذن مؤشر التنمية البشرية يجمع ما بين المكون الصحة والتعليم والاقتصاد في مؤشر واحد. وهذا المؤشر عبارة عن يبدأ من 0 إلى 1، يعني المقياس من 0 إلى 1. مصر الآن مثلا مؤشر التنمية البشرية فيها 0.7، يعني قريب من 1. 1 هو أفضل شيء، 0 هو أسوأ شيء. طبعا لا توجد دولة مؤشر التنمية البشرية 0، لأنه لا بد من بعض التعليم وبعض الصحة وبعض الاقتصاد، ولا توجد دولة مؤشر التنمية البشرية فيها 1، يعني فيها اقتصاد 100% وصحة 100% وتعليم 100%. العالم يتراوح ما بين 4 إلى 9، 9.5 عادة معظم دول العالم. وأنا سعيد جدا بأنه في مصر الآن تم تشكيل يعني منصب لنائب رئيس الوزراء لشؤون التنمية البشرية، لأن أحد أهم مشاكل أو عدم القدرة على الوصول إلى مؤشرات التنمية البشرية بشكل فعال هو غياب التنسيق بين السياسات القطاعية. فنجد بأن سياسة التعليم لا بأس، سياسة الصحة لا بأس، السياسة الاقتصادية لا بأس، لكن التجانس ما بين هذه السياسات مش لا بأس. فلننظر إلى ماذا يعني ذلك. هذا هو واقع المنطقة العربية، هذه هي مؤشرات التنمية البشرية في المنطقة العربية خلال عام 2023-24. فنجد بأن الإمارات العربية المتحدة في المرتبة في الترتيب 17 في العالم، والصومال في الترتيب 193، مصر في الترتيب 109 عالميا في مؤشر التنمية البشرية. عفوا 105 لا 105 105 مصر، أنا معك حق 105. فإذا هذا هو الترتيب الحالي، كما ترون هناك بعض التراجع في بعض الدول بسبب الأزمات الاقتصادية وبسبب النزاعات، وسوف أتطرق إلى ذلك بعجالة. ما هو وضع التنمية البشرية في منطقتنا؟ سوف نجد أن العنصر الظاهر في منطقتنا أن أداء المنطقة اقتصاديا أفضل من أدائها على مؤشر التنمية البشرية. يعني إذا عملنا معامل انحدار سنجد بأن التغيير في الناتج المحلي الإجمالي مقارنة مع التغيير في معدل الفقر نجد بأننا أقل من المعدل العالمي. يعني هناك دول في العالم تحقق معدل نمو اقتصادي شبيه فينا، ولكن تحقق معدلات خفض للفقر أكثر منا. يعني نمونا الاقتصادي لا ينعكس انخفاضا في الفقر، وهذا سؤال مهم يجب أن نسأل أنفسنا لماذا هذا يجري. وهذا بالمناسبة إذا بنلاحظ المغرب، تونس، الجزائر، الأردن، وحتى مصر بعيدة، مع أنها أنجزت في الناتج المحلي إذا بتلاحظوا، إلا أنها لم تنجز النسبة الممكنة في خفض الفقر لدول شبيهة في مصر. يعني معدل نمو الناتج خلال السنوات العشر الماضية قوي جدا، 4.5% تقريبا سنويا، لكنها لم تحقق خفضا في الفقر كما حققته دول شبيهة أنجزت معدلات فقر أقل من مصر. فهذا السؤال، وهذا يجاب عليه بالتنسيق بين السياسات. يعني تحسين التنسيق بين السياسات يؤدي إلى تحسين هذا المؤشر. ونجد بأنه معظم دولنا فيما يتعلق بالناتج المحلي الإجمالي أيضا نفس القضية. في مؤشر التنمية البشرية دولنا أقل من الدول التي حققت معدلات نمو اقتصادي شبيهة بنا. بخلاصة، الناتج المحلي الاقتصادي في بلادنا لم ينجز تنمية بشرية كما أنجز في دول أخرى شبيهة باقتصاداتنا. إذن هذه مسألة رئيسية في المنطقة العربية لابد من التعامل معها. ونجد بأن خصوصا إذا أخذنا في الاعتبار بأن 77% في مؤشر أهم، مؤشر جديد اسمه IHDI Inclusive Human Development Index، مؤشر التنمية البشرية الذي يأخذ عدالة التوزيع وشمول النمو. فنجد بأن أدائنا في هذا المؤشر أيضا أسوأ من أدائنا في مؤشر التنمية البشرية العام، رغم أدائنا الاقتصادي المتميز. إذا نمونا لا يحقق تنمية بشرية كما نريد، ولا يحقق تنمية بشرية تشمل الجميع كما يجب أن يكون عليه الوضع. وإذا لاحظنا بأن معدلات النمو الاقتصادي في منطقتنا خلال السنوات الماضية متذبذبة وليست في معدل ارتفاع. يعني معدل النمو الاقتصادي في منطقتنا لم تحقق خروقات كبيرة في الارتفاع، بل في 2020 في معظم المنطقة هناك تراجع بسبب طبعا كورونا في معدل النمو. ولكن حصة المنطقة العربية من الاقتصاد العالمي في تراجع. يعني لم يتماشى النمو في المنطقة مع معدلات نمو الاقتصاد العالمي، وبالتالي حصتنا اليوم أقل من حصة الاقتصاد العربي في الاقتصاد العالمي عام 1980 رغم تريليونات الدولارات من إيرادات النفط. لابد أن نسأل هذه الأسئلة: كيف ولماذا؟ السبب الرئيسي هو الانخفاض في الإنتاجية. الاقتصاد العربي يعاني من انخفاض في الإنتاجية total factor productivity، إنتاجية عامل الإنتاج، وأن أغنانا وأفقرنا يعاني مشكلة الإنتاجية. يعني سواء كنا دولة نفطية غنية أو كنا دولة فقيرة كلنا نعاني من انخفاض في الإنتاجية، والإنتاجية هي محرك التنافسية الاقتصادية والتنمية البشرية في العالم، وليس كم من المال نمتلك. آخر سلايدين، أنا آسف للإطالة. نحن منطقة تعاني من نزاعات. المنطقة العربية تضم 5% من سكان العالم وتضم 10% من معظم لاجئين العالم، وتضم 30% من كل النزاعات في العالم. إذا نحن منطقة فيها نزاعات، ولا بد أن نسأل ما هي جذور هذه النزاعات، لكن الآن المكان لا يسمح ولا يعني الوقت لا يسمح. ولكن نجد بأن هناك تراجعا في مؤشرات التنمية البشرية على الأقل في دول منطقة بلاد الشام والعراق، الأردن، لبنان وفلسطين وسوريا. هناك تراجعات ملموسة ناجمة عن هذه النزاعات في تلك الدول. وإذا أخذنا فلسطين، فإن فلسطين في غزة عادت 70 سنة إلى الوراء في التنمية البشرية، ودولة فلسطين ككل، قدس الشرقية والضفة الغربية وغزة، تراجعت 22 سنة في مؤشر التنمية البشرية. يعني كل ما بناه الفلسطينيون من تنمية في خلال العقود الماضية اختفى، وبالتالي إعادة البناء يجب أن تأخذ هذا الأمر في الاعتبار، وليس مجرد كم مبنى سنقوم ببنائه. القضية ليست كذلك. ما هي معدلات التعليم، وما هي معدلات الصحة، وما هي عدالة التوزيع، إضافة إلى النمو الاقتصادي. سأتوقف هنا. أنا فقط أردت أن أعطيكم فكرة عن التنمية البشرية وما هو وضعها في المنطقة العربية. وأنا مرة أخرى أؤكد بأنه سعيد جدا بأن هناك الآن اللجنة الوزارية للتنمية البشرية في مصر، لأنه مرة أخرى تنسيق السياسات ما بين السياسات القطاعية ووجود رؤية جامعة لهذه السياسات هي مفتاح تحقيق النجاح في أن تلحق التنمية البشرية بالأداء الاقتصادي. والله ولي التوفيق. شكرا.
Thank you very much, Dr. Al Dardari. Dr. Al Dardari pointed out a number of very important points. The importance of coordinating between different policies, economic and socioeconomic, as well as health and educational policies. He's also pointed out how growth in the Arab world has not been pro-poor as we would like it to be. And finally, he's also highlighted the importance of productivity and the role of conflicts in knocking down progress that's been done in human development. And I would like now to invite Dr. Adel Abdellatif to talk us through the enablers and disruptors of human development. Please.
صباح الخير. أولا نعبر عن سعادتي وجودي معكم اليوم طبعا هتكلم باللغة العربية، يمكن باللغة المصرية أكتر كمان. وفي البداية يعني أتذكر أنه في 2021 من هذا المكان أطلقنا تقرير التنمية البشرية المصري 2021، اللي هو كان بعد 10 سنوات من آخر تقرير في 2010. وده طبعا ده إنجاز مهم جدا لبرنامج الأمم المتحدة الإنمائي وطبعا الحكومة المصرية، لأن فخامة الرئيس كان تحت رعايته إطلاق هذا التقرير. وبعد 3 سنين احنا النهارده بنتكلم عن مبادرة للتنمية البشرية، فأعتقد إنه في ظرف فترة قصيرة قدرنا إن احنا نوصل إلى إن موضوع التنمية البشرية ليس فقط موضوع نظري، إنما هو أيضا موضوع يأتي في صلب عمل التنفيذي للحكومة. وكما نقول دائما إنه عندما نتحدث عن هذه الموضوعات من المهم أن نحطها في إطارها الصحيح، لأن احنا بنتكلم عن موضوع التنمية والسكان. وأنا من ضمن الحاجات اللي بعملها كل يمكن يوم أو كل كام يوم إن أنا أروح لموقع الجهاز المركزي للتعبئة والإحصاء وأشوف عدد السكان في مصر. فالنهارده يعني إيه، قربنا على 107 مليون. 107 مليون مفترض إنه يكون في تنمية بشرية لهم. في سنة 1986 إحصاء 1986 كان عدد السكان 48 مليون. في إحصاء 2017 94 مليون. يعني في ظرف 31 سنة عدد السكان اتضرب في تضاعف. وبعدين من 2017 النهارده من 94 ل 107، يعني نشوف عدد السكان بيزيد ازاي. وبالتالي لما نتكلم عن التنمية البشرية لازم ناخذ في الاعتبار هذا العامل المهم، ان احنا بنتكلم على كل مواطن مصري يكون له حق في التعليم والصحة ودخل طبعا يتيح له حياة كريمة. لذلك زي ما نقول في اللغة الإنجليزية context matters. يعني لما نتكلم على هذا الموضوع المفهوم مهم جدا، واللي تفضل طبعا الأستاذ عبد الله الدرداري مدير المكتب الإقليمي للدول العربية بشرحه وتقديم أيضا الاتجاهات اللي موجودة في المنطقة العربية. لكن أنا أحاول في التركيز في الموضوع اللي أنا أو طلب مني أن أتكلم فيه، هو موضوع الممكنات والعوائق للتنمية البشرية في المنطقة العربية في مصر. فحاولت أن أنا أشوف من داخل مفهوم التنمية البشرية. عندما أطلق تقرير التنمية البشرية سنة 90 كان المفهوم طبعا هو توسيع خيرات الناس. بعدها ب4 سنين التقرير اللي كان في سنة 94 ابتدى طبعا يتعامل مع القضايا. إذا كانت إحنا عايزين نتقدم، إيه المشاكل اللي ممكن تكون معوقة لهذا التقدم، واللي ممكن يكون نحط خط أحمر ما ننزلش عليها. فوصل محبوب الحق وأمارتيا سن إن هم يحطوا مفهوم أمن الإنسان أو الأمن البشري human security، وابتدوا يحطوا بعض المجالات اللي ممكن تكون معوقة للتنمية البشرية. إن هم اعتبروا إنه التنمية البشرية هي التقدم إلى الأمام، وأمن الإنسان أو الأمن البشري هو إزاي إن إحنا ما نرجعش لورا. في ذلك الوقت طبعا هنشوف أول موضوع كان موضوع السكان وموضوع اللامساواة، وبعدين كان في موضوع الهجرة الدولية، وابتدى طبعا الحديث عن موضوع التدهور البيئي، ثم موضوع المخدرات والاتجار فيها، وموضوع الإرهاب الدولي. برنامج الأمم المتحدة للإنمائي في سنة 2008 حاول أن هو يطبق هذا المفهوم على المنطقة العربية. وأنا كان لي شرف يعني المساهمة في هذا التقرير. فوضعنا حوالي 7 موضوعات اللي هي موجودة أمامكم، اللي هي موضوع الموارد، لأن موضوع المية في المنطقة العربية وندرتها شيء يعني طبعا مش محتاج إن احنا نتكلم عنه. ثم موضوع إيه هو دور الدولة بالظبط؟ هل هي الدولة بتساعد في تقدم التنمية البشرية أم هي معوقة للتنمية البشرية؟ يعني لازم نكون برضو إيه يعني منصفين إن إحنا ما نعتبرش الدولة دولة محايدة، أو إن كل اللي بتقوم بيه ده شيء كويس. وبعدين في موضوع هو أمن الشخصي، لأنه طبعا تعرض المرأة بالذات وفئات ضعيفة من المجتمع لتهديدات بيكون أكثر بكثير من فئات أخرى في المجتمع. ثم موضوع التهديدات الاقتصادية والأمن الغذائي، موضوع الصحة، وفي الآخر خالص موضوع طبعا الاحتلال وموضوع الغزو الأجنبي اللي كان ساعتها طبعا في موضوع غزو العراق، وموضوع فلسطين المستمر من سنة 48 بس 67. ده رأي شخصي طبعا. ففي هذا المجال حطينا كل هذه المجالات بنحاول نطبق ايه اللي ممكن يعني يكون بيهدد التنميه البشريه في المنطقه العربيه. وبعدين قفزت الى قمه المستقبل اللي هي حصلت في سبتمبر 2024، والامين العام للامم المتحده وضع اولويات مهمه جدا اللي هي ممكن نعتبرها برضو اللي ممكن تكون من مهددات التنميه البشريه، ان هي بتتكلم على التنميه المستدامه، اللي هي موضوع النزاعات وموضوع اللامساواه يعني لا زال موجود، موضوع تغير المناخ، وموضوع مهم جدا اللي هو موضوع الذكاء الاصطناعي والتقدم التكنولوجي، ثم موضوع فشل النظام الدولي المؤسسي، نتكلم عن الامم المتحده والمؤسسات الاخرى في انها تتعامل بفعاليه مع المشاكل اللي بيواجهها العالم. فأنا عرضت أمامكم هذه المجالات أو العروض الثلاثة، لأنه الدولة أي دولة عند تنفيذها برنامج خاص بالتنمية المستدامة أو التنمية البشرية لازم يكون لها فهم خاص بإيه المهددات. يعني إنه ده ممكن ما ينطبقش على كل الدول. يعني موضوع مثلا الاحتلال الأجنبي مش موجود في كل قارات العالم، لكن في المنطقة العربية طبعا في موضوع مهم جدا هي النزاعات. ومشكلة النزاعات في المنطقة العربية أنها مستمرة وعمرها ما بتتحل إلا نادرا، إلا نادرا. ولذلك وكمان هذه النزاعات بتكون لها تأثير ضخم جدا على الواقع، زي الواقع في مصر مثلا. يعني موضوع التهديدات في البحر الأحمر وكيف أثرت على قناة السويس، ده كان في خارج أي حسابات العالم كله مش في مصر بس، لكنها حصلت وحصلت. والسيد الرئيس تكلم عنها امبارح واكثر من مره، وكمان رئيس هيئه قناه السويس تكلم عنها انه تقريبا ما بين 6 الى 7 مليار دولار هو الفاقد لمصر في هذا المجال. انا لا ارغب ان اطيل، لكن مهم جدا ان احنا لما نفكر في مفهوم التنميه البشريه نفكر برضه مش بس ايه الحاجات اللي بتساعد، لكن الحاجات اللي ممكن تعرقل التقدم. وبعدين حاولت ان انا اشوف طب ايه الممكنات اللي ممكن تساعد على تقدم التنميه البشريه. ونرجع برضه لتقرير من التقارير، هو تقرير هام سنه 2016 كان عن تقرير اللي هو التنميه لكل انسان، وهو عرض ايه المهددات وايه اللي ممكن نامل فيه. لكن انا عشان اختم حديثي في حاله مصر بالذات، عندما نتكلم عن الممكنات فلازم نضع في الاعتبار ان في دور مؤسسي هو دور الدوله، ولازم ناخد في الاعتبار كمان في دور المواطن، لأنه التمكين لا يتوقف على الدولة فقط، لكن المواطن أيضا لازم إشراكه في هذا العمل من خلال أن يبقى فيه إشراك للقطاع الخاص من المجتمع المدني، وعلى المستوى المحلي أيضا يبقى فيه إشراك للمواطنين في إدارة أمورهم. أنا أعتقد أن أنا استخدمت الوقت بتاعي، وأتمنى أن يكون في حوار في هذا المجال ليس فقط خلال هذه الجلسة، لكن خلال السنوات الأيام القادمة. وأنا سعيد جدا كمان بأنه معالي وزير الصحة يشرفنا النهاردة، ودي فرصة سعيدة جدا إن احنا يعني نسمع من سيادتك. شكرا.
Thank you very much, Dr. Adel, for these very valuable contributions. So Dr. Adel has pointed out the importance of population growth and how it can affect progress towards human development. He also reminded us how context matters. He did provide us with a list of challenges to be aware of, from economic vulnerability to conflicts to the role of the state, to human and food security. But he also ended on a high note, giving us the hope we have, so progress can be possible. And now I would like to invite our next speaker, Dr. Elena, to talk to us about how human development approaches can be mainstreamed into national policies. Please.
Your Excellency, Deputy Prime Minister, Your Excellency, also Special Envoy of the Secretary General to this Congress, A.G. Keita, distinguished fellow panelists, and also dear colleagues, ladies and gentlemen. I'm very pleased to join you today, and in the next few minutes, I would like to offer a few reflections with regard to how countries can mainstream human development in their decision making. And I will focus my contributions mainly on strengthening the country systems and placing human development at the heart of the decision making. I will offer I will structure my contribution by elaborating on two overarching points in talking about how to mainstream human development. And also I will mention a few specific examples. So starting from the two overarching points. First, high-level political commitment is extremely important and critical if we are to mainstream human development in the decision making. Because mainstreaming human development usually requires to adjust the government structures, also to shift the mindset of the decision makers and policy makers to make sure that they have the capacity to design, to deliver, and also to measure. And accountability is very important, to keep them accountable in how they deliver human-centered policies. So global experience has shown us that commitment at the highest level of government is critical, as I was mentioning. Why? Because it gives the mandate, the authority, and also the accountability to drive change. And here I will mention specific example that signals that this process of mainstreaming human development had already started in Egypt. And the example is the launch of the National Presidential Initiative BIDEA. That's the first one, and which is under the direction of the highest level of His Excellency, the President of the country, and also together with the appointment of dedicated Deputy Prime Minister on Human Development, and setting up a ministerial committee on human development. That shows commitment at the highest political level and signals the intention to prioritize human development and gives the space and also the necessary support for change across the government. Second overarching point that I want to make, and that's that we don't, and also the policymakers, the decision makers, the ones that need to mainstream human development, they don't start from scratch because there is wealth of knowledge and also experience at their disposal. Even if you take this Congress, the Congress that we all attended, and I would like to commend the Egyptian government for convening it, there are many opportunities and they, in the coming days to share knowledge and also to learn from each other's experience. But one thing that I want to highlight here is the experience from the sustainable development goals. And that experience of implementing the SDGs gives us some guidance with regard to how to mainstream, human development. And there are many references. Why? Because the SDGs also have this multi-dimensional objectives, principles, and also indicators. The ones that Dr. Abdullah was talking about when he was presenting human development to all of us. Approaches to mainstream human development share elements with the approach of implementing the Sustainable Development Goals and mainstreaming them across the policies. Why? Because of cross-sectoral planning, budgeting, and monitoring, both for the SDGs and for the human development. Strengthening disaggregated data, partnerships, and also prioritizing people-centered governance. Also, Agenda 2030 and the principle of leaving no one behind is closely aligned with the human development, reflecting on our shared commitment to inclusivity and also equity. So now I go to a few specific examples, if you allow me. So the specific examples. First, in order to mainstream human development, we need to set up coordination systems that collectively prioritize people's well-being. These collective coordination systems. Example of those, interministerial committees, because they can provide this overall strategic guidance, monitor progress, and also ensure the accountability I was talking about. But they need, and again, I mentioned in the beginning of my contribution, a clear mandate with high-level political support, representation from all the sectors, from all relevant sectors, agreed common goal, and last but not least, this interministerial committee, they need to have regular platforms for communication. So they need to, meet regularly. And Egypt has set a number of those. The Interministerial Committee on Human Development is one example. There is Interministerial Committee on Climate. There is Interministerial Committee also on Food Systems, all these under the Prime Minister, the last two that I was mentioning, and also on Egypt's international human rights obligations. So part of these coordination systems also include platforms that are outside of government. These are platforms that are set up with international development partners, with civil society. And one such an example is, for example, the platform set up by the former Ministry of International Cooperation, now Ministry of Planning, Economic Development and International Cooperation, the so-called multi-stakeholder platform that facilitates this collaboration between the various partners. So it's important also maybe to emphasize here that these coordination platforms, they are very easy. It's not that difficult to set up, right? But what is important is that there is a need for and demand for active management, commitment, and also common agility. So second point with regard to the specific examples, data disaggregation. When we want to mainstream human development, we have to apply data disaggregation. Any mainstreaming initiative needs to prioritize, improve collection, management, and also use of disaggregated data as a central component. And why? We need this disaggregated data because it highlights the different needs of men and women, of people of different age, of people that are based in different geographical locations. And that leads the decision makers into targeted policies. They're able to track progress and also ensure that the efforts which they apply are truly translating into meaningful improvements in people's life. And I would like to mention here something that Keita in her speech, just a few minutes ago mentioned. She said that data-driven action can empower individuals and communities and can help the change that we want to see. And my last specific example, this is with regard to people-centered decision-making. And I think Dr. Adel Abdellatif mentioned, he talked about this, but I would like to also emphasize that point and in a way conclude with this example. People-centered decision-making requires creating meaningful opportunities for citizens, first, to voice their concerns, second, to share ideas that they have, and third, also to influence the policies that affect their lives. And empowerment by itself can be both a means but also an end of human development. And that approach of people-centered decision making, it cuts across the policy process. We can expect and should expect this in the planning involving people in setting local development priorities and also designing programs that address their specific needs, budgeting, giving a public say in how giving people a say in how public funds are allocated, and also monitoring. And this is about also voicing concerns, allowing people to track the progress and also to hold the authorities accountable for delivering results. So one such example, going back to Egypt, of this participatory governance are the national dialogues or the national dialogue. This is a platform where a space is given to citizens to voice concerns, to share ideas, and of course, to place forward the recommendations that have impact from their point of view on their lives. The United Nations here, the team of the UN, will very soon launch a project together with the Ministry of Planning, Economic Development, and International Cooperation that will test participatory models in selected governance. And that project builds on some early examples, such as UNICEF Ministry of Finance participatory budgeting model that was tested in Alexandria and Fayoum. So in closing, I would like, of course, first the government of Egypt for the Congress, and allow me to close by echoing some of the words that were mentioned earlier today by A.G. Keita, that advancing the population health and human development agenda demands international and national collective action rooted in solidarity, equity, and meaningful participation. Thank you for the possibility to contribute and looking forward to the session of Q&A.
Thank you very much, Ms. Elena, for your contribution. So Ms. Elena has kindly reminded us of the importance not just of the capacity to deliver human development, but the importance to have a mandate, to have a political will behind human development policies that could enhance accountability. She kindly pointed out the importance of disaggregated data to provide targeted human development policies. And she also highlighted the role of the coordination between policies, which also Dr. Al Dardari has pointed out in his presentation. So now I would like to invite Professor Tim Evans to talk us through the importance of the quality basic services, particularly health equity in achieving human development. Please.
Your Excellency, Deputy Prime Minister, distinguished panelists and colleagues, many thanks for this invitation to address this very, very important Congress on Population Health and Human Development. It's a great privilege for me to have the opportunity to share a few words on this topic of really ensuring equity in basic services, especially health. I'd like to begin, however, by making a few comments on the primary importance of population measurement, because this enables an understanding of population dynamics and their links to human development and to equity. As the oldest member of the panel, I'm going to make a historical reference that reveals my age in bringing up Sir Edwin Chadwick, whose famous report, The Sanitary Conditions of the Laboring Poor in the United Kingdom, in 1842, described dramatic life expectancy differentials between the dock workers of Liverpool, who had a life expectancy of birth of 15 years, in contrast to the professionals living in nearby Rutland, who had a life expectancy at birth of 52 years. Evidence of this 38-year gap in life expectancy catalyzed policy and reforms to improve the working and living conditions of laborers in the UK. Indeed, Mahbub al-Haq's inclusion of life expectancy alongside education and income per capita in the first Human Development Index issued by UNDP in 1990, I would argue brought a greater sense of urgency and tangibility to invest in human development. Today, in 2024, 182 years after Chadwick's report and 34 years after the first HDI, the world finds itself with measurement power that enables real-time demographic analysis of births, deaths, fertility, mortality, population growth, population movements, age structures, aging, dependency ratios, etc., etc. These demographic variables can be linked to many others, health, education, employment, and well-being, that illuminate the nature level trends of human development. In short, you can get both the scale and detail of human development that is so critical to both informing and reforming policy. And I would like to join the previous panelists, Ms. Popova's comments on the importance of disaggregated statistics. Quality basic health and education services are absolutely critical for human development, but too often they're not universally accessible, and it is the poorer segments of the population that are most often on the short end of the access stick. One of my favorite articles in Public Health is by Julian Tudor Hart, who wrote The Inverse Care Law, published in 1971. Tudor Hart's study of the UK National Health Service, with its provisions for universal access to quality care, found that after 20 years of its implementation, those with lesser means and greater needs, i.e. the poor, were much less likely to access quality care than those with greater means and lesser needs. This pattern of inverse care in the setting of systems designed to be universal is found far too often. The question for those interested in equitable human development, therefore, is how do you break the inverse care laws? Having lived and worked in Bangladesh, I've been impressed at how a country that was liberated in 1971 and deemed by Henry Kissinger to be destined to be poor forever, has consistently defied the odds. I'll provide two examples. First, fertility transition. Bangladesh has gone through a very rapid decline in fertility. And what's fascinating about this decline in fertility in Bangladesh is that it happened whether populations had access to formal family planning control programs. Those populations that didn't have access to those programs seemed to have the same rate of fertility decline as those that did have access to those programs. And in investigating what was driving the decline, they found a variety of other factors, including maternal education and market access to low-cost, good-quality contraceptives as critical drivers of change. A second example, oral rehydration solutions. Bangladesh was a co-discoverer of the famous salt sugar water solution known as ORS that is highly efficacious in saving children from dehydrating diarrhea like cholera. In efforts to scale up ORS to mothers in every household in Bangladesh, despite repeated teaching and support to mothers, the results of ORS use were quite disappointing. It wasn't until they hired an anthropologist who investigated dynamics at the level of the household and realized that men also needed to be trained and be part of the solution. And when they did train men with respect to oral rehydration solutions, the rates of appropriate use of ORS in households in Bangladesh went up to 100%. So these two examples are part of a much larger success story in equitable human development in Bangladesh, and join fundamental observations from the Nobel laureate economist Angus Deaton, who observed that people in poor countries are not sick primarily because they are poor, but because of other social organizational failures, including health delivery, which are not automatically ameliorated or made better by higher income. What Deaton's quote and the Bangladesh examples reveal to me is the importance of learning about SOS, social organizational successes. Cases where local ingenuity in fostering equitable human development in the setting of serious financial resource constraints is proving effective. The Rockefeller Foundation tried to systematize this knowledge in its famous book entitled Global Good Health at Low Cost, where it identified countries like Costa Rica and Kerala State in India that had achieved equitable access to quality basic services with modest expenditure. This thinking evolved further when I was working at the World Bank. While there was consensus amongst decision makers on the fundamental importance of more and more equitable human development, it was difficult to convince finance ministers to shift resources to health and education sectors, as they felt that those monies in these sectors were less likely to fuel economic growth. Drawing on pioneering work of economists like Selma Mushkin and Theodore Schultz, the World Bank identified health and education as the primary drivers of economic growth. This instrumental rationale for investing in the health and education sectors has been helpful in making the case to finance ministers for the health and education sectors to ensure adequate pieces of the country's fiscal pie. Let me conclude my remarks with a tribute from a great mentor to me and to many others here, I'm sure. And it was with respect to the late Dr. Mahmoud Fatala, who passed nearly a year ago at the age of 88. Dr. Fatala was an obstetrician and gynecologist from Asyut University here in Egypt, and is known widely as the father of safe motherhood. As a clinician committed to the health and well-being of mothers, Dr. Fatala was famous for his soft-spoken demeanor and his humility, but his incredibly effective wisdom in drawing the world's attention to to the primary drivers of inequity that erode opportunity for human development. In creating common ground for maternal health, Dr. Fathallah noted, mothers are not dying because of diseases we cannot prevent or treat. They are still dying because societies have yet to make the decision that their lives are worth saving. He aligns with other great health leaders who have strayed beyond the biomedical box when he identified social trauma as the biggest risk to maternal health and asserted that the one prescription women need most is power. Professor Fatallah's words of wisdom are a reminder that valuing all lives equally and creating a preferential option for women and the poor are undoubtedly the most important choices we make as civilized societies. Many thanks for your attention.
Thank you, Professor Evans, for these extremely helpful and valuable contributions. You reminded us of the inverse care, particularly in universal healthcare systems. You reminded us of the importance of giving power to women, and you reminded us also of the importance of SOS, the social organizational successes that are bottom-up and top-down approaches integrated to achieve better results in health equity. And I would like now to invite Dr. Laila Baker to talk us through the interaction between population dynamics and human development. Please.
Statistics around the rises in GDP, around the advancements in healthcare. And in 2024, I can safely say that we are healthier and wealthier than we have ever been in the history of time. But you also heard from our distinguished guests yesterday, from His Excellency President Sisi and from His Excellency the Deputy Prime Minister, as well as Madam Kita on behalf of the United Nations, that there are challenges. There are still remaining issues that we need to tackle. But I'm not going to talk to you so much about the challenges. I want to take a positive turn on this. We are at a crossroads in humanity. And rather than focusing on the challenges and the things that may tend to be defeatist in us, I'd like to focus on how we can leverage them as opportunities. I've been a public health professional and a UN staff member proudly for 30 years. So my journey accompanies that of the Population and Development Conference. And we've dedicated our work as a global community to analyzing, to providing data, and managing all of the population dynamics that you've heard so articulately produced here today. In my role, I have also witnessed firsthand the critical importance of how population dynamics, when it is integrated fully and responsibly and equitably, can lead to better policies, can lead to defeating some of the challenges around urbanization, around the demographic shifts that we see resulting from forced migration, including in conflicts, and from the devastating effects of economic decline. As articulately said here today, however, Addressing health issues is not solely a matter of healthcare provision. It is also about education, about economic development, environmental sustainability, and moreover, I'm passionate about fostering the partnerships that bring together our governments, our civil society, and our communities to develop those holistic strategies needed to align with our aspirations around the sustainable goal in the next 5 years. I think we've heard multiple times, even in the last 24 hours as this Congress begins, and we acknowledge that population and dynamics significantly influences sustainable human development in several key ways. I won't go into all of them, but I hope that you'll allow me to address 4 areas. One is on the planning and resource allocation for equitable and sustainable growth. The second is around that inequality, particularly where the gender gap can lead to very large gains for all of us, and around the importance of social protection programs where healthcare, including sexual and reproductive health and family planning, is integrated not peripherally, but centrally in that discussion. And last but not least, how do these systems come together so that they are not seen as just the sum of their parts, the same as each one of us as one of 8 billion is more than the sum of our own parts. I think people often think about money. In this day and age where it's very critical and governments are straining under the resource allocation demands, both individual countries as well as us as a globe, we often think first and foremost, if only we had more money, if only we had more funding, what could we do? And granted, funding is very important. Money is always important for investment. But we already have more wealth globally than we've ever had before. In my opinion, it is not just a matter of the money that we have globally, it is how those investments take place and engaging from the individual around the choices that are made, all the way up to the policies that we have for fiscal investments that would then equalize what we have in terms of access to quality healthcare. Now, as a woman, it would be wrong of me not to stand here and give my own perspective as well. And some of the other leveraging that we've alluded to, engaging women in the governance structure. How do we close that gender gap that seems so close and yet so elusive that the World Bank and the IMF, the International Monetary Fund, have already quantified for us? You may be surprised, in a 2023 study done by the IMF in Washington, D.C., they were able to quantify for this region alone, country by country, how quickly you could leverage the GDP if only we could close the gender gap, including in the labor market. It was anywhere between 8 points and 23 points in less than 5 years. Even as a person who is not an economist by trade, those are numbers that are easily digestible. And so I ask you to consider those as we go forward and look at the allocation of resources that are tied intrinsically to the choices that we made and how we support every person in their decision making and access to those opportunities. Economic growth and a growing population can lead to great anxiety, as we've seen, including here in Egypt. But a growing population can also lead to a larger workforce. Job creation, if it's kept keeping pace with that population growth, can lead to enormous productivity, not just in GDP, but also in terms of closing that gender gap that we all aspire to. We've also heard quite a bit around social equity, and population dynamics can often highlight those disparities, both in wealth and access to resources. But sustainable development aims to address these inequalities, ensuring that all population segments benefit from that economic growth and social progress. I know that this is a phenomenal lift for all of us. And I know that you've heard from 5 speakers before me, so I don't want to be terribly long. But allow me just to allude to one important aspect. They say that it takes a village to raise a child. I believe that. I work also for multilateralism, as do all of you. But multilateralism cannot thrive in a polarized world that cannot find its community, its village, in the alliances that are predictable and reinforce positive social values. Globally, and certainly in our region, women and girls have long been the backbone of their communities and the heroes that have held the families together. Yet too often their voices have been silenced and their potential untapped, their rights denied or stymied, and their health and prosperity has been curtailed. This is a cause that goes beyond boundaries, beyond cultures, beyond prejudices. It is a cause that speaks to the essence of our very humanity, and that is the right to life, dignity, and the opportunity to freedom and fulfillment. I ask you here to continue to work hand in hand as partners to a future where every individual has that opportunity to thrive, regardless of their demographic background. And let us make this world the one that we have aspired to for the last 30 years. Thank you very much.
For these very valuable insights. She kindly reminded us of the importance of reproductive health, that it takes a village to raise a child, closing the gender gap, and the role of fertility choices in enhancing productivity. I understand we started slightly late, so I apologize if we're gonna, but each speaker has been very kindly sticking to the 10 minutes allocated. And I would like now to invite our last speaker, Mr. Sean Johns, who's going to be telling us about all of the above.
Shukran, Sabah al-Khair. It is a pleasure to see all of you here today. And I know we are running against the clock at this moment because we all started a little bit late. Thank you for continuing to listen to some of the terrific speakers that we've heard from today. This is a global conference, of course, and I thought I would share maybe a little bit about the governance structures around deliberate management of a human development initiative on the part of a government. Of course, the United States government is deeply committed to fostering human development because it is about investing in people here in Egypt, but also around the world. And it's fundamental to building global resilience. And sustainable world. Human development is more than just economic, than just health. It is about ensuring that every person in the world has the opportunity to reach their full potential. The United States and many of the countries you represent, including Egypt, believe also that it is an investment that with expected returns. So in that endeavor, let me talk a bit about the governance structures or the governance considerations as we invest in human development. Dr. Abdallah mentioned the 3 pillars of the Human Development Index around health, knowledge, and the standards of living, which necessarily leads itself into good governance, how those 3 considerations are prioritized. There is an active, a necessary role of government and governance in deliberately investing in human development. So in that context, let me start out with 5 considerations. First consideration is that the investments that we make in human development should guide the kinds of economies that we want to have in our countries. Dr. Abdallah talked a little bit about the role of economic development in ensuring that there are sufficient resources, there's sufficient prioritization on what is called the people-centered approach. That economic structure and the focus of an economy should be mutually reinforcing of all the investments that you want to make in the people of a country. Number 2, we've talked about in this panel already the fact that data should be driving policy making. Following data and understanding the data helps us to understand where we prioritize, where we invest, the kinds of partners and resources that you want to bring together to invest in the people of your country as well. Number 3, and this is a challenge for every government and every organization, including my own government, is to be highly integrated in the way that you pursue human development investments. And that is to say that health or education or economic development, that they don't act as single pillars, but rather that they are working together in a cohesive picture to achieve people-centered objectives and goals. That would identify and help us identify those priorities that we're trying to target together as a government, as a society, to identify those resources that aren't in just one ministry or even just in government. They're in the private sector, they're in civil society, they are found in our communities, and making sure that those resources are brought to bear towards those common objectives. Number 4 is that by investing in resilience, the ability of our communities and our households and our governments and our societies to withstand economic, health, and other shocks helps you to weather out those investments, those challenges that come over time, the things that knock down your human development, the kinds of conflicts that we might see or the economic challenge we might see. And then lastly, number 5, it's all about, I think that Dr. Laila Baker mentioned, it takes a village for these kinds of investments to occur, that human development successes to occur. The fact is that every country, every organization needs partners and partnerships. You cannot do it alone. There is no doing this alone. There should be an openness on behalf of all of our organizations to align ourselves and ally ourselves with partners who are willing to co-invest in all of those things that make human development objectives and successes. So with that, let me close just by saying that, again, this is a priority for the U.S. government, but it's for all of us and all of our organizations I view these 5 areas as the most sustainable way to create peaceful, prosperous, and resilient societies. And we look forward to continue our partnership with all of these organizations, but with all of you as we move forward towards achieving our ultimate objectives in human development. Thank you very much.
Thank you very much, Mr. Sean Johns, for reminding us that growth needs to be centered around human development and prioritizing people-centered approaches, of highlighting the importance of data and integrated approaches in promoting human development, and in the role of building the resilience of systems and communities to withstand shocks, and the importance of partnerships. I understand we started late, and I have been told that the time for this session is coming to an end, but I will break the rule. I feel we will be very contradictory if we do not allow at least 2 questions. So really, if we're talking about inclusivity, if we just go now, it will be very contradictory. So I apologize, but for those of you who can't sit and or wish to ask 2 burning questions, we might just open the floor for 2 very burning questions to get your voices also to be heard, please. Anybody would like a question? Everybody wants coffee? All right, where is it? Sorry. Oh, yes, please. Yes. Would you like to stand up and I will repeat your question? Thank you very much. So the first question, and I will take volunteers to answer it. The first question is, what are the first steps that you think need to be taken to integrate health and education services in order to promote human development? So where do we start? Excellent question. Thank you. Where do we start? Any? Yes, please, Tim.
So it's an excellent question of where to start. I think the life course is a great place to start around women and children. That is the nidus of human development, and making sure not only that you have safe delivery and you get through that first year, but that you complement it with early childhood development. And that's, I think, where you have a very virtuous intersection between health and education. So that would be my very quick answer to what I would think is a very good place to start. It's often much easier to derive consensus around mothers and children than it is around elderly people like me who are seen to make bad choices because they're not paying attention to what they should be. So I think start early in the life course, and especially around early child development.
Okay, I have been told off because I broke the rules. So I'm afraid we need to put that session to an end. But I would like to thank the panelists for their excellent contributions, and thank you for your listening. You can communicate with the panelists over coffee. Thank you very much.